Okay, now we are moving on to the adrenal glands. I think this is probably one of my favorite areas to go over, just because we are affected so much now by stress. And I say now because it really seems to be part of our society that we have to be busy all the time. And when we have a time that we get to actually sit down and rest, we find that we don't really know what to do with ourselves. And I hope that with time, we learn how to change this to make our lives less stressful, because we're definitely going to be healthier people if our lives are less stressful. Stress has a huge impact on our body. So first, just a little bit of information about the adrenal glands. They're located right above the kidneys on both sides of our body. They're comprised of two parts, the cortex and the medulla. The medulla, or the inner part of the adrenal glands, produces the hormones called norepinephrine and epinephrine, or adrenaline, which regulate the fight or flight response in the body's reaction to stressful events. The cortex, the outer portion of the adrenal glands, produces several hormones including cortisol, DHEA, and aldosterone. The hormones, when we go to see a classic Western medical doctor and we say we'd like to have our adrenal function tested, what they will be looking for, if we're talking about underfunctioning of the adrenal glands, is called Addison's disease. This is the classic textbook case. When it was first discovered, tuberculosis, but now autoimmune disease, causes destruction, and also infectious disease, malignancy, lymphoma, and rarer causes like leukodystrophy. What we see most of the time, and what we're treating almost 100% of the time here at the clinic, is adrenal insufficiency. It's not true Addison's disease, where there is extreme deficiency of cortisol, but there is definitely a deficiency and even possible a low normal level. This dysfunction, due to adrenal burnout from stress, high carbohydrate intake, alcohol, toxins, and autoimmune disease, will lead to a person feeling poorly as well. The things that we might see with people who have adrenal insufficiency are lassitude or fatigue, exercise intolerance, which I mentioned before, where fatigue worsens with exercise and is relieved by rest, low blood pressure and dizziness when standing, generalized muscle weakness, anorexia and weight loss, salt craving, sensitivity to opioid pain relievers and sedative drugs, slow recovery from minor surgery, blood sugar. And here are some of the clinical manifestations. Again, loss of underarm and pubic hair in women, muscle pain and joint pain, anxiety, memory disturbance, depression, actually in 20 to 40% of the people, and psychosis that can manifest in many different ways. And then two rare manifestations, hyperpigmentation or darkening of the skin, and nausea, abdominal pain, or diarrhea alternating with constipation. Dr. Tintera, who wrote The Hypoadrenocortical State and Its Management, was one of the leading doctors in describing adrenal insufficiency or adrenal fatigue versus Addison's. He found in his research that the most frequent symptoms are as follows: fatigue, 94% of the people, nervousness and irritability in 86%, depression in 79%, apprehension 71%, excessive weakness in 65%, lightheadedness in 47%, fainting or fainting spells in 42%, and insomnia in 40%. Some of the clinical conditions that can be associated with adrenal insufficiency include chronic fatigue syndrome and fibromyalgia, chemical sensitivities, multiple hard-to-treat food and or environmental allergies, refractory asthma, meaning asthma that keeps coming back, glaucoma, anxiety disorder, and loss. There's a lot of different ways to test for adrenal insufficiency, but there's two primary ways that I would recommend choosing from. One, which is my starred area, meaning that I really like this one as my primary way of determining adrenal insufficiency, is with a 24-hour urine collection. This will give you an average of cortisol, cortisone, aldosterone, DHEA, and the metabolites of these hormones over a 24-hour period. This is done through Meridian Valley Lab. And then there's a saliva test, and this gives you 4 measurements for cortisol at different times of the day and 1 measurement for DHEA. This follows the natural rhythm of cortisol during a 24-hour period. This is through ZRT Laboratory. Now let's just assume that you have adrenal insufficiency. What should we have you do? First and foremost, like we talked about with Candida, is what do we do with your diet? You want to eliminate high sugar and high refined carbohydrate, as this is stressful to the adrenal glands. This is becoming a theme here in my talk. Looks like sugar is just not good for the body. Then, fatigued adrenal glands are also unable, though, to tolerate high protein diets, such as the Atkins diet. So you want to have a balanced diet with whole carbohydrates, good fats, and protein. Frequent small meals and avoidance of prolonged hunger is recommended. Allergy elimination, especially of foods, and treatment are very important in some cases. And then salt intake should be liberalized. High salt is encouraged if blood pressure is low. And I need to make a point here that a lot of us are now eating sea salt. And sea salt doesn't have very much sodium in it. So when you have adrenal insufficiency, you really need to go and get that regular old iodized salt because we need the sodium. Now we go on to supplementation for treatment. These are the more important nutrients. First being vitamin C as sodium ascorbate. This is a buffered form of vitamin C. 2 grams twice a day. Pantothenic acid, which is also B5 at 200 to 1,000 milligrams twice a day. Vitamin E as mixed tocopherols, 400 to 800 international units daily. Vitamin A at 40,000 units daily. Vitamin B6 as pyridoxal 5-phosphate, the active form of B6, at 50 milligrams daily. And this can come in the form of a B complex. B12 as methylcobalamin or hydroxycobalamin. These are the longer acting forms of B12 at 1,000 to 2,000 micrograms daily, either under the tongue or as an intramuscular injection. Chromium at 6,000 micrograms daily for 30 days, tapering to 2,000 micrograms. And usually we do this in divided dosage, so meaning if it's 6,000, you'd take 2,000 3 times a day. Licorice root at 2 to 3 grams twice a day for 6 to 8 weeks, then tapering down. And an adrenal glandular at 300 milligrams once a day in the morning. My favorite brand here is Allergy Research. An adrenal glandular is actually from an animal, and it's an extract of the adrenal gland. It's thought to help by providing nutrients that help strengthen the adrenal gland and also having very, very, very small amounts of all of the hormones that are contained in the adrenal gland. We can also treat adrenal insufficiency if it's severe enough with hydrocortisone. This is bioidentical hydrocortisone, meaning it looks exactly like the cortisone that we produce in our own bodies. Physiological studies indicate the normal human adrenals secrete about 15 to 20 milligrams of cortisol on average day, 15 milligrams more for women and 20 milligrams more for men. So the starting dose is about 2.5 to 5 milligrams, and that's used 4 times a day according to symptom severity. The dose should be monitored with a 24-hour urine test for cortisone, cortisol, and their metabolites. And then when you're ready to stop, a gradual titration is recommended. This is all based on the book by William Jeffries called Safe Uses of Cortisol. I'm sure that most of you, when you hear this, are concerned because we usually think of cortisol as cortisone or prednisone as being really damaging to the body. But here we are using the bioidentical cortisol in amounts that are similar to what the body produces on its own in people who have low levels already. So we're bringing those levels up to what we would consider normal. The treatment I don't usually recommend long term, but it does give the body a break and the body an ability to start to heal. So you use this in conjunction with the nutritional therapy. And after about 6 months, or maybe less, or maybe longer, you start to gradually titrate off the hydrocortisone. And this is definitely a prescription. Here we have 2 different people who had their cortisol level checked at specific times of the day. So they have it starting at night when they turn their lights out, and you can see that both have lower levels when they go to bed. After 4 hours of sleep, it's still pretty low, but then it starts rising, and at about 8 hours, when you would wake up in the morning, the level is quite high. Then it gradually comes back down. So 4 hours after you wake up, it comes down, and then it'll go back up again. So 8 hours after you wake, there'll be another peak. And then it comes back down and up and down again to be low right before you go back to bed. So you want it low before you go to bed so you can fall asleep easily, and then you want it high in the morning so that you wake up refreshed. This is where the salivary testing for cortisol comes in handy, so that you know where your cortisol is low or high. And this is also helpful in knowing when to take the cortisol. The other thing that can be replaced with adrenal insufficiency is DHEA. Most cases of adrenal fatigue have low DHEA. It can be increased naturally, though, by meditation, spiritual time, recreation, etc. The suggested dose, either transdermal or under the tongue, is 5 to 15 milligrams for women and 20 to 50 milligrams for men. And you definitely want to monitor your level here. Sometimes people will get side effects, especially women, of whiskers or acne if they're taking too much. If you'd like to know more about adrenal fatigue or adrenal insufficiency, Dr. Wilson has written an excellent book, and Dr. Wright actually wrote the foreword. This is a view from Orcas Island. I recently took a 4-day trip with my family and stayed on an organic farm called Pebble Cove Farm. It was absolutely amazing. They had a little boat where you could row out into the water and climb up onto this little island and just take a break and look out. It was definitely relaxing and very good for my adrenal glands.